Second only to skin cancer, prostate cancer is the most common cancer in American men. Now, new guidelines for screening. KITV4's Jill Kuramoto explains.
The American Cancer Society estimates more than 238,000 new cases of prostate cancer will be diagnosed this year. But in a major shift earlier this month, the American Urological Association guidelines on prostate screening were narrowed. The AUA now saying routine screening not necessary for men 40 to 54 years old and screening not recommended for men 70 and older. Local doctors are saying, hold on.
We should actually suggest that all men by the age of 40 have their first PSA. And when they're finding the PSA less than 1, they probably don't need to be checked until they're maybe 50 or 55. After that, it's really if they have a risk factor.
PSA standing for prostate-specific antigen, the test that identifies prostate cancer risk. The reason for tightening the guidelines was to avoid unnecessary cancer treatment. But doctors here say men in Hawaii tend to live longer, and factors such as radiation and Agent Orange exposure increase the risk in men.
Doctors say one of the keys to identifying whether you're at risk for prostate cancer is to simply talk to your family.
Very commonly we have people that come in and say, well, my dad had a prostate problem, but I don't know if it was cancer or not. Well, then go back to his physician and find out.
The guidelines do say those men at higher than average risk, such as those who have a family history of prostate cancer or African American men, should discuss with their physicians the benefits and harms of starting screening before the age of 55. Something doctors here agree upon. Jill Kuramoto, KITV4 News.
Better testing is now coming out that can identify the more aggressive forms of prostate cancer. Although a serious disease, the American Cancer Society says most men diagnosed with prostate cancer can survive.